Dr. Brad Conder here, and today I wanted to talk about the 4 most common causes of knee pain. And a lot of times when people think about knee pain, they think about a couple of conditions. They think about arthritis, they think about tendonitis, and they think about meniscus tears. So the hard part is that some of these things are just going to happen. Like, for example, arthritis and meniscus tears, these things just happen normally. We've shown research showing that these things will happen. Sometimes you can do things that maybe make them a little bit harder, as far as them maybe coming on sooner, as far as you're hard on your body, you play sports, or you stand a long time. Some things can cause those issues to kind of come up a little bit quicker. But we do know that arthritis and meniscus tearing can be normal. Now, some other things that you're going to see is maybe tendonitis and kneecap problems. So those are the other 2 pathologies that we see. So I want to kind of go over the top 4 causes of knee pain. Number 1, I would say that the main cause is going to be like overuse. So overuse is going to be things like you stand for a long period of time, you sit for a long period of time, or even if you haven't really walked that much or ran that much, and all of a sudden you go walking or running. So all those conditions we mentioned, knee pain, arthritis, meniscus tears, tendonitis, that all can kind of flare up just due to those lifestyle changes. Now, another cause of knee pain might be actual trauma. So trauma could be like you fell on it, you had a car accident, something along that lines. And what can happen is you can flare up some of these conditions you might have as far as arthritis or meniscus and kneecap problems. The third cause is going to be more of like sports-related injuries, or not even just sports, and just activity-related injuries. So this is an important cause too. So a lot of times, at least here recently, I've been seeing a lot of people, they will have knee pain because they decide they want to walk a lot, or they want to get in shape, they wanted to kind of run. And so what they'll do is they'll do an activity that they haven't really done in a long time. So they'll go from not walking at all to go walking 3 miles a day. And they're like, I didn't do anything. Well, you did do something to kind of change your activity level. And your knees, maybe they weren't flexible enough, maybe they weren't strong enough, maybe they just weren't ready for the activity. And if you had a little bit of arthritis, you had some meniscus issues you didn't know about, and plus you can cause kneecap problems to kind of actually like tendonitis or actual patellofemoral syndrome, what we call it. All those things have to work just right to make sure the knees function well. And lastly, a lot of times your knees can start having pain from other parts of your body. So the last cause can be other chain issues. So for example, you can have feet problems, you can have back problems, you can have ankle problems. All those things if they're out of whack a little bit or not functioning well, can give your knees a lot of extra stress and cause you to have knee pain. So those are the 4 things. The first thing is overuse. Second thing is trauma. Third thing is change of activity or sporting activities. The last thing is other body deficits, such as low back pain, ankle pain, foot pain, that can add to knee pain. So I hope this information helps you out a little bit as far as some of the main causes of knee pain. So see some of our other videos to kind of see how you might be able to get some of your chronic knee pain better and actually be able to function better. Thanks a lot, and talk to you soon.